Desmopressin, also known as Nocdurna Tablet, Disintegrating, is used to control the amount of urine your kidneys make. It is a man-made form of a substance called vasopressin, and is used to replace a low level of vasopressin in the body. This medication helps to control increased thirst and too much urination due to certain conditions, and helps prevent dehydration. It is also used by adults who wake up 2 or more times during the night to urinate, and it helps reduce how often you wake up at night to urinate. Additionally, it is used to treat children who wet the bed at night, and helps decrease the number of times the child urinates and wets the bed. The recommended daily dosage and the optimal timing to take this medication should be consulted with your healthcare provider. Before taking Nocdurna Tablet, Disintegrating, make sure to read the medication guide from your pharmacist. To take this medication, remove the tablet from the packaging with dry hands and place it under your tongue. Leave the tablet under your tongue until it dissolves. Do not chew or swallow the tablet whole. For the treatment of diabetes insipidus, take this medication by mouth as directed by your doctor, usually 2 to 3 times a day. For the treatment of nighttime urination, take this medication by mouth as directed by your doctor, usually once at bedtime. Limit the fluids you drink, especially 1 hour before you take this medication until 8 hours after the dose. For the treatment of bedwetting, take this medication usually once a day 1 hour before bedtime. Children should limit the fluids they drink after dinner, especially 1 hour before bedtime until the next morning, or at least 8 hours after the dose. If your child wakes up during the night, limit the amount that your child drinks. Limit drinking water and other fluids while taking Nocdurna Tablet, Disintegrating. Consult your doctor for details. If you find that you are drinking more fluids than directed, tell your doctor right away. Dosage is based on your medical condition and response to treatment. Do not take more Nocdurna Tablet, Disintegrating, or take it more often than prescribed. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Tell your doctor if your condition does not get better or if this medication stops working well. If you experience headaches, nausea, upset stomach, or flushing of the face, you should notify your doctor or pharmacist. It's important to remember that your doctor prescribed this medication because they believe the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While rare, a severe allergic reaction can occur. Seek immediate medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088, or in Canada, you can report them to Health Canada at 1-866-234-2345. If you are prescribed Nocdurna Tablet, Disintegrating, it's important to be aware of the potential side effects. This medication can rarely cause low levels of sodium in the blood, which can be serious or even fatal. Factors such as drinking too much liquid, using certain medications, being 65 years or older, or having certain medical conditions may increase the risk of low sodium in the blood. Before starting this medication, you will need to undergo lab tests such as urine tests and sodium blood levels. It's important to keep all medical and lab appointments while using Nocdurna Tablet, Disintegrating. If you experience symptoms of low sodium in the blood, such as nausea, vomiting, headache, muscle weakness/cramps, unusual tiredness, unusual drowsiness, dizziness, restlessness, or mental/mood changes including confusion or irritability, it's important to inform your doctor immediately. In the event of very serious side effects such as seizures or trouble breathing, seek medical help right away. It's important to follow your doctor's instructions and discuss any concerns or questions you may have about taking this medication. Before taking Nocdurna Tablet, Disintegrating, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have kidney disease, heart problems, high blood pressure, or certain brain or adrenal gland disorders. If you become dehydrated, your doctor will address that issue before starting treatment with Nocdurna Tablet, Disintegrating. It's also important to limit alcohol consumption, as it can interfere with how well the medication works. Be sure to inform your doctor right away if you develop any illness that can cause water/mineral imbalance, such as fever, diarrhea, or vomiting, as the doctor may need to adjust your treatment. Before undergoing surgery, inform your doctor about all the products you use, including prescription drugs and herbal products. It's also important to note that children may be more sensitive to the side effects of this drug, while older adults may be at greater risk for certain imbalances. If you are pregnant, only use this medication when clearly needed, and discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before using Nocdurna Tablet, Disintegrating. Always make sure to follow your doctor's instructions and ask any questions you may have about the medication. When taking Nocdurna Tablet, Disintegrating, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Nocdurna Tablet, Disintegrating include glucocorticoids, steroids, taken by mouth or inhaled, tolvaptan, and water pills/diuretics such as furosemide. Be sure to discuss any potential interactions with your doctor or pharmacist before taking Nocdurna Tablet, Disintegrating to ensure your safety and the effectiveness of the medication. If you or someone else has taken too much Nocdurna Tablet, Disintegrating and has severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call 1-800-222-1222 for your local poison control center. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include severe or persistent headache, confusion, drowsiness, and sudden weight gain. Remember to always keep this medication out of reach of children and pets. This medication should only be used by the person for whom it was prescribed. Do not share it with others. If you are prescribed Nocdurna Tablet, Disintegrating and you miss a dose, here's what you should do. If you take one dose daily, take the missed dose as soon as you remember. If you don't remember until the next day, skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. If you take more than one dose daily and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose and take your next dose at the regular time. Do not double the dose to catch up. When it comes to storing Nocdurna Tablet, Disintegrating, it's important to keep it in the original package at room temperature, away from light and moisture. Make sure to store it in a place that's not accessible to children and pets, and definitely not in the bathroom. And when you no longer need the medication or it reaches its expiration date, it's important to dispose of it properly. Don't just flush it down the toilet or pour it down the drain. Instead, consult your pharmacist or local waste disposal company for the best way to get rid of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.